Hi, my name's Kylie Greentree. I'm a district vet working for the Hunter Local Land Services. As a district vet, we deal with all livestock, but I have a particular interest in goats and goat medicine. And so over the last few years, I've built a goat group together that I send a monthly newsletter to on something that might be seasonal or topical or just an interesting case that I've seen. So the last bulletin that I put together was on geriatric goats, and so I'm here in the Lower Hunter on a lovely property. I have a producer here, Ayla Davies, who's going to help me out. These are some of her older does that are going to be our models for today, and we're going to go through some of those question and answers, a few questions that I've been asked over the last few months on older goats, and just help get the information out there to other producers. This is Ayla Davies with some of her girls. She's just going to get them up. I just wanted to demonstrate, often when they get up, some of these older girls, they might have a little bit of arthritis, a little bit sore on their feet as they rise up, and a bit lame. This is quite common as they get a little bit older. Often they'll warm up after a few steps. So you can see this girl's a little bit tentative on her feet. Sometimes people will ask how old a goat will live for, so it's very dependent on a number of factors. As you can see, Ayla's opened up, showing the teeth here. So teeth are certainly something that will contribute to how well they get the nutrition out of their diet and then production wise. So as you can see, this girl, she's 11. And so we would call her a broken mouth goat. So she really, she's on some beautiful soft feed here, but often when they get to an age where whether they have a broken mouth, often they'll have to, because they need fibre in their diet, they might need to have their hay cut to a shorter stem length so they can actually chew it up, otherwise they will have difficulty. So we're going to show a few other goats and their teeth, but basically the age of a goat, generally if it's a pet goat that's not high producing, would be like 16 to 18 years, similar to a dog. But if they're a higher producing animal, their lifespan is definitely decreased. So those high yielding dairy goats, their lifespan's generally about 10 to 12 years. So they all vary. Oh, so this girl here, she's 84 kilos. She's certainly not suffering in any way. If we look at body condition score, it is a bit trickier in older girls, that they do start to lose a bit of their top line, their muscle mass as they get older. But she has really at 11 not lost much of her muscle mass at all. So you can have a look at her side on and feel she's got a lovely covering over her ribs. So having basically no incisor teeth, the front teeth, has not affected her in body condition score. These boar goats will the does generally 60 to 80 kilos, so she's high in weight generally compared to a lot of the boar goats that we see around. So she's those teeth are not affecting her too much at this stage. Production wise, as producing kids, they start to, it also varies as to when they will stop producing kids, and that's another thing people will often ask. So she's probably not producing as many kids as she would have in her prime, and they just, it depends on their physiological state as to when they stop producing kids themselves. Barry Schumann here, who's just trimming this goat's feet. It's very important to trim the goat's feet on a regular basis, otherwise the hoof wall will start to grow over and turn over the toe, and then they'll become lame, and then more susceptible to arthritis. So you can see the white spongy part in the middle, that's called the sole, and you want the outer wall to be at the same level as that sole. So where Barry's cutting now is the heel, and he's cutting up the wall. That's like the toenail that has no blood supply on the outside, and he's cutting the wall so it's level, nice and flat surface for the goat to walk on. So that's it's a nice flat foot then, so as they walk on the ground, it's just like they're not walking on high heels. So you can see that lovely white sole there. So you can see now that that foot's been placed down. She's the coronary band, or the top of the hoof here, is sitting basically parallel to the ground. So she's standing nicely and a lot less susceptible to getting arthritis. So it depends on the terrain that these animals are walking on. These girls are walking on a lovely soft pasture, so they're not going to wear their feet down, and then consequently they need to be trimmed more regularly. But if they're on a rough terrain, then they would be not needing as frequent trimming. Barry's got another 11-year-old girl here, 82 kilos, so once again still in good condition. She's got all her teeth, but as you can see, as they get older, they start to narrow, and you get more gaps in their teeth. She's still got all her teeth, so that's good, but they start to kind of round off. Often they will go forward and become loose, and then they might drop out, but she's still got them all there. So this is Francesca. She's 11-year-old as well. She's starting to get these gaps between the teeth and the roundening off at the top. But I just wanted to also mention that if you have any goats that are starting to eat on the side of their mouth, or they have cud between their cheek and the molar teeth at the back, then potentially there might be something going wrong. There might be a spike at the back of the mouth that's causing a bit of abrasion to the cheek or the tongue, and that's certainly something that needs to be investigated further. It's very difficult to have a good look at those teeth at the back because they've got such a narrow mouth, goats, that they get quite sharp, and it's very difficult to look unless they're under sedation. So it may require, if you're having issues, if they're having difficulty eating, then it may pay to get a private vet to come and have a look at your goat and see what's going on in the back of the mouth. They would use sedation and a gag to have a good look at the back of the mouth, and they may have a tooth root abscess or some kind of gum disease or tooth disease going on that need, or a tumor as they get older is something also that is quite common. So I just wanted to also show you this girl here. If I can get her either back on or front on, you can see, yeah, there, you can see that she's got quite a protruding abdomen. Now she's not pregnant, she's been like this for several years. So often when the muscles, abdominal muscles, are under a lot of pressure, the muscle layer will herniate, and they'll get that kind of protruding abdomen. Sometimes it'll be more underneath, and so you'll see that the udder drops right down. With this girl, it's more on the sides that you can see the protrusion. So often it's a good idea not to breed with these ones. They can potentially have difficulty with herniation of the gastrointestinal tract, and you can, they can require either removal from the herd or surgery to fix that kind of herniation.
issue.
So if you have any further questions on geriatric goats or anything really to do with goats, please send me an email on kylie.greentree@lls.nsw.gov.au. If you want to be a part of my goat group, then also drop us an email or drop the Hunter Local Land Services an email, and I'll pop you on our goat group email list, and you'll get a monthly newsletter, and I'll let you know of any workshops that we're putting on as well. So thanks for listening. See you later.